Laparoscopic tubal ligation was actually a tubal ligation technique, tying the tubes for permanent sterilization. Has been around for many, many, many years until a minimally invasive laparoscope was introduced in North America in the late 60s, early 70s. It was always done through a small incision above the pubic bone. With the laparoscope, we moved to a single or a double small holes in the belly button or in the side, identify the tubes on each side, and block them with several techniques. One would have been cauterization of the tube, or placing a Fallop ring, elastic plastic type of ring that slides over the tube and blocks it, or Halka clips, like any kind of a clip that could block the passage or block the opening of the tube, or even resecting the tube completely and tying it. This is still a very actual, very present time type of a technique that is used all the time, because this is truly a minimally invasive technique. The patient comes in maybe a half an hour before surgery and goes home 2 hours later and goes back to her family activity within 24, 48 hours with very minimal discomfort in the belly button and perhaps some shoulder pain from the gas that's strapped under the diaphragm and refers the pain to the shoulder for several hours due to irritation of the base of the diaphragm. So it's truly a minimally invasive, quick recovery type of surgery. Efficacy rate of the tubal ligation is in neighborhood failure rates of less than 1 in 1,000. Postpartum tubal ligation is another technique that either is performed during the C-section surgery and delivery, but it could be done through a small incision in the belly button 24 hours or so after delivery, because uterus is still elevated close to the umbilicus, and therefore the retrieval of fallopian tube is easy through a small incision that's probably no more than half an inch or 3/4 of an inch, and the patient would go home as though she didn't have a tubal ligation within 48 hours or 72 hours after delivery. The recovery time after a postpartum tubal ligation, if it's performed as a part of cesarean section, does not contribute to the length of recovery. Postpartum tubal ligation that follows vaginal delivery, and it's performed within 12 to 24 hours after delivery, may extend just slightly the discomfort in the belly button for 24 hours, but does not influence the recovery time.